Hi, I'm Yurlis Calmarin, currently working in a government and private institution in Bacolod City, Negros Occidental, Philippines. I graduated in University of St. LaSalle in Bacolod and had my psychiatry training in Cebu. I'm interested in human behaviors, fascinated with the complexities of how the brain works, and I am also interested in mindfulness. Community psychiatry focuses on the detection, prevention, and early treatment and rehabilitation of emotional and behavioral disorders as they develop in a community. It comprises the principles and practices needed to provide mental health services for a local population. By first, establishing population-based needs for the treatment and care. Second, by providing a service system linking a wide range of resources of adequate capacity operating in accessible locations, and lastly, by delivering evidence-based treatments to people with mental disorders. There is a wide range of work when it comes to community psychiatry. It involves educating the public on mental health issues, educating other health workers in providing mental health services to the community, establishing programs that will provide the members of the community an avenue for psychological support, establishing mental health education programs, providing training for the community health professionals such as physicians, nurses, midwives, barangay health workers, and community volunteers. It also encouraging individuals to engage in psychiatric consultation and treatment, and liaise with other government and non-government organizations that provide mental health-related services to the community. In 2018, the World Health Organization launched the Mental Health Gap Action Program known as MHGAP. In the Philippines, health workers are trained on MHGAP. This is to bridge the gap between available resources and needed services. The training gives health workers the tool to effectively manage and provide treatment to persons with mental, neurological, and substance use disorders using algorithm for clinical decision-making in a non-specialized setting. Prior to that, it was just done by the NGOs, and then they were training local government unit, rural health centers, especially in provinces where psychiatrists are not available. And of course, there are many psychiatric patients in the community. Mental health services in the community can promote accessibility, acceptability, affordability, and scalability of services. This is based on a study of Patel et al. In 2018. It also promotes open-mindedness, adherence to treatment, receptive and compliant to therapy, and increased likelihood of positive clinical outcomes. Community services play a crucial role as it promotes mental health awareness, reduce stigma and discrimination, support recovery, and make mental health services available for all. In the Philippines, around 14% of a population of 1.4 million Filipinos with disabilities were identified to have mental disorder, and it is the third most prevalent form of morbidity. According to the WHO data published in 2020, suicide death in the Philippines reached 2,325 or 0.34% of total deaths. In India, there is 2.05% of suicide death, ranking them number 41 in the world, and Japan with 1.76% suicide death, ranking them number 49 in the world. In community psychiatry, we focus on preventing psychosocial problems or their consequences by reducing their population rates, either incidence of new cases, prevalence of existing cases, and rates of residual disability. Giving mental health services in the community also helps prevent mental health disorders. The increasing number of patients with psychosocial and psychiatric issues and disorders have been challenging for me since a lot of patients are queuing and cannot be accommodated right away. This is also due to the shortage of mental health workers, wherein nationally, there is a little over 500 psychiatrists in practice. Another challenge is the shortage of facilities in provinces, municipalities, and in the city, which makes me prioritize patients who are in need for admission. Thus, some patients need to wait, and the families may feel exhausted and will lead to caregiver burnout. It is also quite challenging to encourage patients and their families for psychiatric consult due to stigma and discrimination. They would even go to unproven traditional treatments rather than seek professional help. These are some of the barriers to their help-seeking behaviors. Another one is wherein the allocated budget for mental health is 3 to 5% of the total health budget, with most of their expenses are out of their pockets. This can be one of the reasons some patients still have poor adherence to medications and are prone to relapses. Usually for my patients, we have a wide range from children to old age. Like we can see patients like 6 years old until 90 years old. It depends if the patient needs therapy or needs the medications or both medications and therapy. So we see them both in our government institution and also in my private practice. We have patients that are being referred to us by other patients, by our colleagues, and most of our patients actually just come in our clinic, or they just call hotlines and ask for schedules for an appointment that they want to have a consult with us. There are a number of psychotic patients who for years have been chained or imprisoned in their own homes, wherein family members would likely give up on them. So these patients were brought to the clinic, given treatment, and during follow-up consults, you'll see psychotic symptoms decreased or even disappeared. Patients were able to do their daily activities, help in chores, able to work, and improve their quality of life. This makes my work fulfilling to me. It is like my heart is leaping with joy, seeing the smile on the faces of their family members and giving them hope. It is also quite rewarding for me as I interact with the people with mental health illnesses like depression, anxiety, and bipolar disorders, which gives me the privilege to know what these patients deal with and how I can help them improve their lives. So these patients teaches me empathy, compassion, patience, and the importance of not giving up on oneself. Each one of us is facing different challenges, fears, worries, and difficulties in life, in different levels and in different degrees. To the general public, let us be more empathic, compassionate, and kind to the people around us. Empathy means seeing yourself standing in someone's shoes. It is our feeling of awareness toward other people's emotions and an attempt to understand how they feel, while compassion is walking with them. It is an emotional response to empathy and creates a desire to help. To give empathy and compassion, let us learn to understand how they live their lives. Talk to them, listen without judgment, acknowledge their feelings, show concern and emotional support, advocating for them, or volunteering for a good cause. Importantly, people should not stigmatize and discriminate individuals with mental health issues, calling names, isolating, and bullying them, not downgrading how they feel, and stop using hurtful vocabulary such as insane or crazy. Mental health can be promoted through being aware about it. Talk about mental health as if this is a normal part of the conversation to neighbors, friends, workmates, parents, and children. This could also be integrated with existing programs in the community. If they have identified individuals, they may link or refer to their rural health centers or agencies. And if someone in the community have been having psych consults, they may encourage individuals in their community to also reach out and seek help. Let us not forget there is no health without mental health.